Magandang gabi mga kaibigan. Welcome po dito sa Radyo Klinika sa DWIZ. Ako po si Maru Pahati Sarne. Ngayong gabi, ituloy po natin ang ating talakayan tungkol po sa ADHD kasi alam ko pong marami pa rin kayong mga katanungan tungkol po sa kondisyong ito. Kaya ngayong gabi kasama po natin muli isang napakagaling po na psychiatrist mula po sa ADHD Society of the Philippines. Wala po iba kundi si Dr. CARLO, BANAAG. Doc, magandang gabi uli.
Hi. Hello.
Yes,
Nice to
Doc.
be here
Yeah, thank you so much.
virtually.
Oo. Doc, actually, maraming tanong tungkol doon sa ano ba yung kaibahan daw ng attention deficit hyperactivity disorder doon sa attention deficit disorder.
Oh, pareho lang yun.
Pareho lang.
Oo, dati they used to distinguish pa, but actually, ang terms ngayon, yung ADHD inattentive type, yan yung primarily inattentive, hindi sila hyper, restless. Merong yung hyperactive impulsive type, and merong yung combined type. Madalas pag girls, mas madalang yung hyperactive impulsive type. So madalas may delay sa diagnosis kasi hindi sila problematic sa grade school, parang naka-zone out lang sila, nakatulala. But they're not giving people headaches. So may delay sa diagnosis. Yung boys are more likely to have yung hyperactive impulsive type or the combined type. So pwedeng mas maagang na diagnose.
So yung mga batang pasaway, sasabihin ba natin baka meron silang ADHD?
Hindi naman kasi pwede naman talaga pasaway ang bata.
Oh, okay.
So I'm not a child psychiatrist, pero alam ko they need to see the symptoms in more than one setting. Hindi pwedeng ganun siya sa bahay, pero pagdating sa school, okay na.
Oh.
Or opposite.
Oo, so kung ganun, baka walang ganung kondisyon, baka meron lang kinalaman yung environment niya.
Yeah, kailangan
okay.
i-assess. Baka mamaya nag-act out because of problems. Something like that.
Okay. Pero totoo ba, Doc, na may kinalaman ng genes o heredity sa pagkakaroon ng ADHD o ng kondisyon na ito?
Strongly genetic ang ADHD. Yung nabasa is, if a child has ADHD, may 29% chance na at least one parent ADHD din. So it does tend to run in families.
Na baka si parent hindi lang din na-diagnose at naka-cope din siya dun sa struggle niya, dun sa school, at saka sa work, sa life,
Yep. Madalas yun. Pag naririnig ng parent yung symptoms, they'll start thinking, parang ako yata yan. Then it starts to make sense.
Oo. Pero, Doc, meron bang mild, moderate, at saka severe ADHD? May ganun bang?
I guess there is. But ano siya it seems to matter more kung ano yung situation mo. For example, somebody who may have technically worse ADHD, more severe symptoms, pero ang trabaho niya, let's say, artist, painter, ganun, or disc jockey, radio jockey, or mga talk show host. Pwedeng malala yun, pero hindi mo mapapansin. Baka okay nga whereas somebody na technically milder yung symptoms, tapos na-promote siya, na siya yung parang executive assistant na sa vice president, doon yun, parang kahit relatively milder, mas may impact yung symptoms.
Okay. Yung ba nga mga nanay na nung sila'y pregnant nag-iinom ng alak, naninigarilyo, o kaya yung partner nila naninigarilyo, so na-expose sila doon. At premature din yung delivery ng kanilang baby. May chances din ba ng pagkakaroon ng ADHD ng bata?
Hindi ko matandaan, but Google is our friend. So, posibleng merong environmental risk factors. I think matagal nang hinahanap yan. For environmental risk factors. Pero as far as I know, wala pang clear cut na, pag ito nangyari. There have been some studies looking at parang pesticides, fertilizers, but I'm not sure kung merong significant correlation.
Basta talagang ang pinaka nakikita ng science dito, yung tungkol sa wiring. Yung kanilang neurochemistry, tama ba, Doc?
Yeah. There's something different about the ADHD brain. It's I describe it to people like ano na, iba lang yung wiring. You could be very smart. But if your brain only activates pag last minute na, mahirapan ka pag madami na yung executive demand.
E paano yung kunyari, ang parang feeling nila, parang hindi ko ma-achieve yung potential ko. And they get frustrated. And minsan dumarating sa point na nade-depress sila at nakakaisip ng, alam mo na baka kailangan tapusin ko na itong buhay na ito kasi parang walang nangyayari sa akin.
Yeah, that's an important consideration kasi talagang mas prone ang ADHD na tao sa depression and or anxiety and even things like substance use, kasi nagsa-self-medicate. Stress is what makes the brain unhealthy. Basta tuloy-tuloy mataas ang stress levels mo, iba-ibang effect sa katawan yan, di ba? For some people, lumalakas yung acid sa tiyan. Kaya naka-stress ulcers, nagkaka-GERD, lumalala yung acid reflux nila. For other people, pag may chronic stress, na-affect yung immune system. Malakas yung mga pimples, rashes, nalalagas ang buhok, madali magkasakit. May affect din yung stress sa brain. The chronic stress can make the brain unhealthy. And yung most common outcome, yung depression and anxiety. And people with ADHD, they're living with more stress than the neurotypicals do. Kasi yung taken for granted ng neurotypical, hirap na hirap sila. Even things as simple as filling out forms in a bank. Para sa ibang tao, parang, ang dali niyan. Ako na, gagawin ko na. Pero pag ADHD ka, you always have to check, double check, nagkamali ba ako? Did I miss something? Am I doing the right thing? Parang ang hirap mag-adult pag may ADHD ka. So, when you get pushed out into the world, you may not be ready. In fact, the chart yan, si Dr. Russell Barkley, showing kung ano yung relative, yung executive age mo compared to actual age. Kasi ang lumalabas is, ang laki ng difference. Pwedeng, check right now. Pwedeng, kunyari, yung actual age mo is 20 years old ka na, yung executive age on average is parang 13-year-old. Pag 24 ka, yung executive age mo is 16. So eventually humahabol. So like when you're 30 years old, yun na, parang 20-year-old na yung executive function mo. But that's not where the problem happens usually. It's usually pag early on. Imagine kung nasa high school ka, kunyari, 15 years old ka, diba? May expectations na sa'yo, but your executive age is closer to that of a 10-year-old. So yung ability to plan, to be consistent, to manage your time well, parang 10-year-old ka. So may disadvantage and it takes a lot more parang effort on the part of yung tao na ADHD.
Oo. Pero yung non-medication, kunyari, hindi ka kasi kaagad na nakita, na diagnose. Pagkatapos, you just went on with life. Tapos, yun, punong-puno ng struggle. Yung non-medication during those times na nag-i-struggle ka, hindi na bang mag-lead yan to mental retardation, Doc?
Hindi mental retardation. That's something completely different. But it can increase your risk for depression or anxiety. And even if it doesn't do that, even if you don't get clinical depression or an anxiety disorder na nagpa-panic attack out of nowhere, malaki ang chance magkakaroon ka ng low self-esteem.
Okay. Ngayon, merong iba pong ADHD, yung sabi mo yung Doc, nag-try mag-take ng mga drugs para siguro i-quiet down yung kanilang utak o kaya para kalmahin yung kanilang sarili. At dahil doon na abuso nga nila. May mga nagsasabi po na kaya daw nila ginagamit itong some kind of drug na ito kasi parang bigla daw na biglang yung kanilang mind o yung brain nila, parang biglang may na-push na button doon tapos biglang umaandar at nagiging aktibo sila doon sa kanilang ginagawa. So, hindi ba delikado yung Doc?
Hindi ko naman alam kung ano yun.
Oo.
I don't know what that is, what this person is using, pero statistically, kids who don't get treated for ADHD are 7 times more likely to get into substances. So, protective yung na-identify ng maaga, natitreat. Usually, they don't get into substances because they think, I think I need something para maging tahimik yung utak ko. They don't even know na the way their brain works is not the same as yung peers. It's more likely that they'll get into it kasi nga, nag-low self-esteem na, doon na sila sa mga the delinquents, the bad boys. So that's how it gets introduced to them. Later on, pwede nga, dahil mataas ang anxiety nila, ADHD people live with anxiety. They kind of need a certain level of anxiety just to stay on task. Pero pag sobrang anxious na, hindi na helpful. Nafe-freeze na sila instead of getting them activated. So very often they get into drinking, or marijuana.
And instead of using illegal drugs, why not try the medicines na ipe-prescribe sa inyo ng totoong manggagamot ng isang katulad ng isang psychiatrist, di ba?
Mas madaling mahanap yung illegal drugs kasi.
Yun nga lang.
Peers nila.
Oo nga. Yun ang
easier for them to access it.
Oo. So bilang magulang, paano natin magagabayan yung ating mga anak at saka matutulungan kung sakaling may ganito silang kondisyon para hindi sila aabot dun sa punto na yun na they will search for answers doon sa kanilang problema?
Well, there's a very good website, yung Attitude Mag, and of course yung sa ADHD Society website. Maraming information doon to help you pick up on
Attitude Mag?
Attitude, ADDITUDE.
Attitude.
Attitude.
Okay. Okay.
But, syempre, check out yung sa ADHD Society.
Okay. Oo.
Targeted siya sa Philippines.
Oo. May kinalaman ba, Doc, yung pagiging mataba sa pagkakaroon ng kondisyon ng ADHD?
Well, I'm not sure kung may correlation, but yeah, people with ADHD, they tend to be impulsive, they tend to take less care of themselves.
So kain kasi ng kain. Oo. Totoo ba, bawal sa kanilang tsokolate daw, Doc?
Naman.
Oo. So walang problema yung mga stimulating na mga pagkain. Yung parang nakakapagpa-add ng energy sa'yo.
No, actually, madalas, well, sugar is bad in general. The same inflammation that stress causes that makes the brain less healthy. Galing din yan pag unhealthy yung diet. So tumataas din inflammation at the gut level. So it's a good idea to avoid things like that, yung highly processed food, yung sugary sweets, kind of, because it makes the brain less healthy, not because it makes the ADHD worse. But many kids nga, pag bibigyan mo ng stimulant, doon sila kumakalma.
Okay. So, pero instead of medicines, pwede raw ba na magpa-counsel na lang sila o yung mag-undergo ng behavioral therapy, Doc?
Studies show na yung behavioral therapy doesn't seem to help that much because they can get good at what they're told to do in the therapy session, but it doesn't seem to generalize to the rest of their life. Mas effective pa rin talaga yung education, maintindihan mo what you're dealing with, how your brain works, and then figure out how to work with your brain instead of trying to force it to be something it's not.
Okay. Pero Doc, magkaiba ba yung treatment para sa mga batang may ADHD at yung mga natagpuang may ADHD kung kailan adult na sila?
Oo, kasi pag adult ka, hindi ka na pwedeng pagalitan masyado. Hindi ka pwedeng time out. May difference talaga. Pag adult, it's usually them who come asking for help. Pag bata, they don't even know what's going on. So, swerte na lang if the parents pick up on it na sobrang distress na yung anak ko. Something's not right. I can see na nagsastruggle siya, and then they bring the kid for help. So, hindi ako child psych, so I'm not sure exactly what is done sa kids na ADHD. But my dad is a child psychiatrist. Ano tuto ko sa kanya is, it's better na maaga pa lang may intervention. Kasi kung hindi, may downstream effect. Nalilabel na yung kid as a troublemaker, as unreliable, magkakaroon na siya ng anxiety among his peers, pwedeng nabubully. Kasi nga, they can stick out like a sore thumb. So, mas maganda, maaga pa lang, na-address. Hindi yung, like, why would you put a kid through that? Hindi naman nakasalanan yun.
Yung sinasabi nila, Doc, na kapag daw kasi bata sinimulan na i-treat, baka daw ma-over-medicated naman daw yung bata. O kaya baka pag sa school, hindi siya maka-function na mabuti because of the medicines. Oo.
That's weird. Yun yung nagko-correct. So, if you can't produce your own neurotransmitters, store-bought will do. Diba? You wouldn't tell someone na they're having trouble walking, who needs a wheelchair. You wouldn't tell them na huwag ka mag-wheelchair kasi bata ka pa, baka maging dependent ka sa wheelchair mo. You won't do that, diba?
So it's
why
a
would
myth,
you,
oo. It's a myth,
yeah.
yung tukol dyan sa over-medication na yan, tsaka yung sinasabi nila na
Well, you have to find the right
magiging robot
treatment.
daw yung bata.
Iba na yun. I don't even know where that's coming from. They're thinking of completely different meds. Baka hindi sila mga antipsychotic. Hindi naman. For ADHD, hindi. That's flat out. Once you get the right treatment, you'll be better. Now, when I say treatment, I don't just mean the meds. Siyempre, yung coping strategies, yung environment sa bahay. Kailangan ina-address din yung stress. Baka nag-act out yung kid kasi ang daming problema sa bahay. There's no medicine that will fix that.
Of course, oo. Baka yung magulang ang dapat na mag-fix ng kanilang sarili para maging maayos din yung kanilang mga anak. So, speaking of that, ang poor parenting daw ba ang nagsasani ng ADHD?
No, it's not. Myth din yun. You can't. It's like saying poor parenting is what causes autism. Hindi. It's there. It's already wired. Their brain is just wired differently. Kung sa autism, it's yung social fibers na something went wrong sa development. Sa ADHD, it's the executive functioning area ng brain na affected. And it's not necessarily a bad thing. Last year lang may article that came out which postulated na it could be an evolutionary advantage na about 5% of the human tribe may ADHD. Kasi ito yung mga tao na they'll be the explorers, they'll be the inventors, they'll be the ones finding new places to hunt, new places to live. They'll be the people seeing danger coming from far away. Kasi yung gaze nila is always outward. Hindi sila focused sa day to day. So it could be an advantage na may ganong percentage, which is what it is, about 5% of the population. Could be useful for the rest of the tribe na may tao na ganon. In fact, recently lang, meron silang sinusundan ng mga nomadic tribes. In other words, yung parang ang buhay nila parang yung ancestors natin bago nagka-industrialization. And dun sa nomadic tribes, yung mga tao na may ADHD syndrome, yung parang symptoms na mukhang ADHD, sila yung best fed, most successful, most respected. So it's really more like your brain is wired a certain way. And if you find the right place for it, it's good. It's not a bad thing. But of course, the world will be designed for the 95% of people who don't have ADHD.
Okay. Well, yung tukol naman doon sa pagkakaroon ng iba pang disorder. Kunyari, may ADHD ka tapos meron ka pang personality disorder. May nangyayari bang ganun, Doc? O kaya may bipolar ka pa?
I'm not sure about your personality disorders. I think it's easy to mistake something else, like an actual medical condition, for a personality disorder. So hindi dapat willy-nilly, personality disorder yan. Alamin mo na kung there's something driving it. But yes, genetic. There are four major mental health conditions na they share genetic links. So parang magkagrupo yan. ADHD, autism, bipolar disorder, and schizophrenia. Doon sa apat na yon, ito yung mas magkalapit and ito yung mas magkalapit. Kaya madalas may overlap talaga yung ADHD and autism. Sometimes it's hard to tell. Yung parang yung ayaw yung sa maraming tao, ADHD, parang na-overwhelm siya kasi parang can't keep track of all the conversations, or sitting autism and feels very awkward. Hindi alam kung kailan time to leave a meeting. Kasi yan sa akin. But it also means na they're also higher risk. Like, lalo na pag ADHD and bipolar, ang hirap malaman Kasi pag bipolar ang tao and they're manic, it looks like ADHD. And then when you ask, hindi, dati na akong ganito. But the bipolarity, yung mania, just exaggerates yung pagka-hyper nila. So minsan, mahirap. But meron talagang ganun. It's more common than we might think.
Pero pag ADHD, hindi naman ibig sabihin na talagang rowdy, magulo, ganyan, yung talagang kiti-kiti, gano'n. Hindi.
Usually habang tumatanda, nawawala yun. Kasi they learn na hindi to acceptable. If you have an adult who's still jumping on tables at a meeting, ibang sakit nun, hindi ADHD yun.
Ayun daw.
So, baka schizophrenia yun or something. Pero, mas kita yung ganon, yung hyperactivity, pag bata. Kasi they don't know better. Habang tumatanda, mas natitira yung inattention, yung hyperactivity, baka mas nagpe-present sa lagi na kinakalikot sa kamay, galaw ng galaw sa seat, ng ganon. Pero hindi na yung parang obvious na it would be disrespectful or not socially allowed.
Okay. O yun na nga eh. Ang mga ADHD na bata rin, parang nag-speak out sila palagi. No? Nag-speak up sila na napapagkamalan tuloy sila na mga bastos na bata. Pero actually, it was parang normal lang yun sa kanila.
Daming meme na ganyan na the ADHD kid, the one guy who will say out loud what everybody else is thinking. Kasi sabihin na eh, wala masyadong filter, yung impulsivity. It can work out well. Sometimes sila yung life of the party, but it can also be not so good na parang, ay, bastos naman yata.
Yeah. Lalo na sa kultura natin mga Pinoy, na hindi tayo sanay na basta nagsasalita ang mga bata lalo na sa paikot sa mga matatanda, di ba? Oo. So, pwedeng may ganung condition. Pero pag habang lumalaki, because of culture, because of nababago yun, yung ganung
the cultural pressures. Yeah, it can actually add to your anxiety.
Also, nakaka-adjust naman pala ang isang ADHD sa kung ano ang kanyang environment. Nakakapag-adjust naman siya, Doc.
Depende. Hopefully, yeah. If they're not, if they can't, then lalong magkakasakit sila. Lalong pataas na pataas yung stress.
Okay. Pero how about sa work? Paano sila mananatili at makaka-keep up dun sa kanilang work environment?
Ganon din. They just have to figure out how their ADHD works. Everyone is different. Some people even work better pag may something going on sa background. Ang ibang tao naman, the slightest sound, parang they can't stop hearing it. So, depende.
So, adjustment din ang gagawin nila dapat.
Yeah. Oo. Yeah. But, I mean, hindi man siya, you don't have to announce to everyone, I have ADHD, kailangan masundan yung gusto ko. Hindi naman, you can just talk to your boss. For example, kung ang workstation mo, nandun siya sa daanan ng mga tao, and you realize na tuwing na dumadaan, nag-distract ka, tapos hindi mo na mabalikan yung ginagawa mo, mag-request ka, dun ka sa end of the hallway. Para hindi na lakad mga tao in front of you.
And of course, katulad din ng ating palaging ipinapayo po, magpatingin po sa isang eksperto, katulad ng isang psychiatrist. Dahil hindi naman lahat na nagpapatingin sa psychiatrist, yun, yung parang mayroong stigma na baka may
95% 95% na tinitingnan namin, puro mga anxiety and depression. Depression is number 1 sa top 10 causes of work disability worldwide. Anxiety is number 7. During the pandemic, 42% of adults nagkaroon ng clinically significant anxiety or depression or both. That's in the general population. That's lahat, 42%. So it's a lot more common than you would think. Usually, yan yung tinitreat ng psychiatrist.
Okay. So, pwede po kayo magpatingin din kay Dr. CARLO BANAAG. Nag-online consultation ka na, Doc?
Yes. Pero parang I heard medyo mahirap maghanap ng appointment. So, you can go to the medical city. Marami naman din na magaling na psychiatrist. There's a number. Or look, Google nyo lang yung Medical City Center for Behavioral Health. And you can access. Siyempre marami ibang places like PGH. For people na financially strapped, pwedeng pumunta doon sa outpatient nila. It doesn't have to be expensive to get treatment.
Yeah, even National Center for Mental Health is also catering to people who have anxiety, depression, di ba? Yeah. Oo. So wag niyo po isipin talaga na kapag nagpatingin po kayo sa psychiatrist, yung extreme na paniniwala natin tungkol sa mga may mental health problem. Actually, siguro halos lahat tayo nagkaroon ng mental health problem, lalo na ngayong panahon po ng pandemya. So, we need an expert para maipaliwanag po itong ating nararamdaman at naiisip at para mabigyan po ng solusyon ang ating kalagayan. Lalo na, yung mga anak po natin, hindi natin pabayaan, bata pa lang sila, patingnan na po natin if kinakailangan. Kaya nagpapasalamat tayo sa ADHD Society of the Philippines na tumutulong sa napakarami pong mga posibleng undiagnosed pa ang kanilang kondisyon na ADHD. And to you, Dr. Carlo Banaag, for explaining these things to us. Maraming baka ako nga yan.
Huwag naman sana, pero huwag kayo mag-rely sa TikTok.
Oo nga. Dapat ikaw nagti-TikTok, Doc.
Hindi ko marunong dyan.
Doc Carlo Banaag, maraming salamat po. Thank you so much sa inyo. Thank you so much. Si Dr. Carlo Banaag po. Yes, Doc. Maraming salamat.
Thank you.